Hi, Dr. Friends. Today's topic is again most common pathway which are most important for your nearby NEET PG exam, and can't miss this video till last. And let us start without wasting of the time. Start with most common aortic branch involved in the Takayasu arthritis is the left subclavian artery. The most common karyotype chromosomal abnormality in the US is the Down syndrome, and the most common osseous lymphoma. Primary and the secondary, it is the diffuse large B cell lymphoma. Next, one of the most common primary malignant orbital tumor is in childhood is the rhabdomyosarcoma. The most common abdominal emergency of early childhood is intussusception. The most common acetabular fracture is the posterior, and the most common affected wall segment in the tuberculosis is the ileocecal area. The most common affected joint in the goat is the first metatarsophalangeal joint. The most common AIDS-related neoplasm is the Kaposi sarcoma. Most common allergic aspergillosis syndrome is the allergic bronchopulmonary aspergillosis. The most common anatomical variant of the pancreas is the pancreas divisum. It is the most commonly asked question, and which are most commonly repeated question. So in I have told the 10,000 question, it is under that. The most common anomalous course of the RC is the interarterial. The most common appearance of the Legionella at the peak of the disease is the bilateral airspace consolidation. This is also under that question. Next one is the most common associated anomaly with coaptation is the bicuspid valve. And the most common association of PAPVR is the sinus venosus type AST. Most common association with a small left colon syndrome is the maternal diabetes, and the most common benign cardiac rhythm abnormality is the PIC. The most common benign cartilage containing tumor is the osteochondroma, and the most common benign growth of the skeletal is the osteochondroma. This both are under that the 1000 question, and the most common benign hepatic lesion is the hemangioma. Next one is the most common bladder neoplasm in the children younger than 10 years is the rhabdomyosarcoma. This is also under that 1000 question. The most common bone to develop an osteochondroma is the femur, and the tibia is the second most common. First is the femur. The most common brain anomaly on the prenatal sonogram is the isolated mild ventriculomegaly. The most common breast tumor under the age of 25 years will be the fibroadenoma. It is also most common. The most common cardiac manifestation of the systemic lupus erythematosus, it is the pericarditis. It is also most common. Most common cardiac valvular tumor is the papillary fibroelastoma. Most common carpal dislocation is the transscapuloidal perilunate dislocation. The most common causating organism of acute pyogenic meningitis in the adult is the streptococcus pneumoniae. This is also under that 1000 question. Most common causating organism of the neonatal pyogenic meningitis is the E. coli. This is also most important. Most common cerebellar neoplasm in the children is the medulloblastoma. This is also under that 1000 question. The most common cerebral mass lesion in the AIDS is the toxoplasmosis. This is also most important question. And the most common chest radiograph finding seen in the patient with the acute PE, it is the atelectasis. This is also under that section. The most common chest X-ray abnormality in the ICU is the atelectasis. This is also most important. I am asking the most important question. That means the which are most commonly repeated question, and many times asking the different type of medical PG exam. So you have to remember such type of the most common topic. So you can't miss a one or two question or four question event. Most common child abuse fracture is the diphyseal fracture. This is also important question. Most common collagen disorder of the pleural effusion is the SLE. This is also most important question. The most common colonic polyp, hyperplastic polyp, and the most common complication of the ERCP is the pancreatitis. This is also most important question. Most common complication of the popliteal artery aneurysm is the distal ischemia or thrombosis or embolism. This is also important question. The most common complication in the IVC filter is the DVT, deep venous thrombosis, and the most common primary demyelinating disease is the MS. MS. So MS is the most important. Is the it is the multiple sclerosis, which are many times asked in the NEET PG question about the misthenia. Sorry, multiple sclerosis. It is the most important question. You have to read more all things about the multiple sclerosis. One question always we asked: most common primary female urethral malignancy is the squamous cell carcinoma. This is also most important question. Most common primary hepatic neoplasm in the infant, the children less than 5 year old is the hepatoblastoma. It is also most important question. And the most common primary intraocular neoplasm in the adult Caucasian as the uveal melanoma. Next one is the most common primary malignant rib tumor is the chondrosarcoma. Chondrosarcoma. Both are repeated, so you have to remember rib. And this is also most important question. Most common primary malignant sacral tumor is the sacrococcygeal chordoma. This is also many times repeated question, so you have to remember is this type of the question. The most common primary malignant soft tissue tumor of the late adult life is the soft tissue MFH, and the most common primary neoplasm of the spleen is the cavernous hemangioma. Next topic is the most common primary neoplasm of the anterior superior mediastinum is the thymomas. It is also most important question. And the most common primary posterior mediastinal neoplasm is the neurogenic tumor. This is also most important question. The most common primary tumor of the diaphragm is the lipoma. This is also important. You have to read about the lipoma, all things, so that you can't miss. It is time of the revision of the all the topics, all the most common topics, so that you can't miss. Most common radiation induced CNS tumor is the meningioma. It is also most important topic. The most common sex cord stromal cell tumor is the ovarian fibroma. This is also most important. And most common spermatic cord tumor. Spermatic cord tumor is the lipoma. This is also most important question. The most common spinal cord tumor ependymoma. It is also in the important question. Most common submucosal tumor in the colon is the lipoma. So this is also important. Most common supraciliar mass is the craniopharyngioma. This is also most important question in the view of the radiology. The one question in the radiology on the base of the craniopharyngioma, and craniopharyngioma is the most important. One question will be asked. Most common syndromic isolate cell tumor is the insulinoma, and the most common testicular tumor in the young boy Here the word is used young boy, yolk sac tumor, and the most common trigonal intraventricular mass in the adulthood is the meningioma. Also important question, the most common tumor of the adenohypophysis is the pituitary adenoma. Most important question. The pituitary gland itself a one or two question. So you have to revise about the pituitary gland so that you can't miss one or two question. The most common tumor of the genitourinary tract is the metacoronous TCC, transitional cell carcinoma, and the most common tumor of the appendix is the carcinoid tumor. It is also most important, very most important, most common tumor of the esophagus is the leiomyosarcoma. This is also most important question. The most common tumor of the minor salivary gland is the adenoid cystic carcinoma, and the next one is the most common vascular tumor of the orbit in the children is the capillary hemangioma of the orbit. Most common component of the mixed germ cell tumor is the embryonal cell carcinoma. And most common glial tumor in the NP1 is the JPA, and the most common glial tumor with the microcalcification is the oligodendroglioma. This is most important topic. Most common gynecological neoplasm is the uterine leiomyoma, that means fibroid. This is most important question. Most common intramedullary tumor in the children is the astrocytoma. This is also very most important topic. The most common intramedullary tumor of the adult is the ependymoma. This is also most important. And most common intraocular neoplasm in the childhood is the retinoblastoma. It is also very important topic. The most common intraorbital tumor found in the adult is the cavernous hemangiomas. It is also most important topic. The most common liver tumor after metastasis is the hemangioma. Also repeated, most common intravascular venous tumor, the leiomyosarcoma of IVC, and most common in uterorenal tumor is the mesoblast nephroma, and most common invasive gynecological malignancy is the endometrial malignancy. This is also most important question, and you have to revise the malignancy the TNM classification about the endometrial ovarian carcinoma. That means one question always on the basis of the ovarian endometrial malignancy TNM classification. The most common isolate cell tumor in the main one is the gastrinoma. This is main 1, main 2, and main 2A, main 2B. Both are very important. I have already told about the main 1, main 2A, and B. So most common isolate cell tumor of the pancreas is the insulinoma. This is also most important topic. The most common malignancy of the childhood. Here the malignancy of the childhood. So leukemia is the most common. The most common malignancy of the parotid gland in the adult mucoepidermoid carcinoma. This is also most important. And the most common malignant abdominal neoplasm in the children 1 to 8 year old. 1 to 8 year old. You have to remember 1 to 8 year old it will be worms tumor. The most common malignant bone tumor in the children is the Ewing sarcoma. This is also most important question. So Ewing sarcoma about in the osteology and the radiology. This is the most important one question always repeated about the worms tumor and the Ewing sarcoma. Next one, the most common malignant neoplasm of the diaphragm will be the Fibro Sarcoma. Most common malignant neoplasm of the spleen is the lymphoma. This is also in the important section. Most common malignant ovarian neoplasm is the serous adenocarcinoma. serous adenocarcinoma. The most common malignant ovarian neoplasm is the serous cyst adenocarcinoma. These both are same. The most common malignant primary bone tumor in the young adult and child is the osteosarcoma. This is very important topic. Most common malignant radiation induced tumor of the skeleton system is the MFH. The most common malignant sex cord is multiple granulosa cell tumor. Most common malignant testicular neoplasm is the non-seminomatous germ cell tumor. It is also most important topic, and granulosa cell tumor also important topic. The most common malignant tumor affecting the ribs. Here the word ribs, children, adolescent. That means AIIMS sarcoma. Next one is the most common malignant tumor of the duodenum is the adenocarcinoma. The most common malignant tumor of the heart is the angiosarcoma. The most common mass lesion of the cerebellopontine angle after acoustic schwannoma is the meningioma. This is also important. Most common mediastinal germ cell tumor is the seminoma. Next is the most common mediastinal mass in a child between the age of the 6 and 12 years old is the lymphoma. The most common mediastinal neurogenic tumor is the schwannoma. This is also important. And most common mesenchymal origin neoplasm of the GI tract is the GIST. GIST is very important topic, so you have to remember all thing about the GIST. The most common metastasis to the spleen is the breast carcinoma. This is also important. Most common metastasis to the heart, melanoma. This is most important. The most common non-epithelial malignant bladder tumor is the Rhabdomyosarcoma. This is also important question. Most common non-epithelial tumor in the colon is lipoma, and the most common non-epithelial tumor of the bladder myoma. Most common non-glial primary tumor of the central nervous system is meningiomas. Most common non-lymphoproliferative primary malignant tumor of the spine in the adult, it is chordoma. The most common non-lymphoproliferative primary malignant tumor of the spine in the child is the pinate. The most common primary brain tumor will be GBM. Most common primary benign mesentery tumor is the desmoid tumor, and the most common primary cardiac tumor in the adult is the primary cardiac tumor. Word is used primary cardiac tumor, so in the adult, so it will be myxoma. The most common primary cerebellar mass in the adult is the hemangioblastoma, and most common cancer, that means leukemia less than 14-year-old, it will be the ALL, acute lymphoblastic leukemia. Most common cancer leukemia more than 60 years, it will be the CLL. Next one is the most common leukemia 15 to 39-year-old, it will be the AML, and the between the 40 to 60-year-old, it will be CML. That means more than 40, it will be CML, between that AML. Most common cancer in the gynecology is the endometrial carcinoma. This is all are important. Most common cancer in the infancy is the hemangioma, Most common cancer in the kids, leukemia. Most common cancer in the men is the prostate carcinoma. The most common cancer in the women is the fibroid or leiomyoma. Most common cancer of the adrenal medulla adult, it will be the pheochromocytoma. And most common cancer of the adrenal medulla kids, it will be the neuroblastoma. Next one is the most common cancer of the bone metastasis from breast and prostate. Here the word is the cancer of the bone metastasis. That means in the bone metastasize from the breast and prostate. The most common cancer of the bone primary adult, it is the multiple myeloma. Most common cancer of the brain of the child is the medulloblastoma, that means cerebellum. The most common cancer of the breast is the infiltrating ductal adenocarcinoma. Most common cancer of the connective tissue is the benign lipoma, and most common cancer of the esophagus is the leiomyoma. And the most common cancer of the esophagus is the malignant squamous cell carcinoma. It will be the more than adenocarcinoma. Most common cancer of the heart adult metastasis. Most common cancer of the primary heart primary adult, it will be the myxoma. The most common cancer of the heart primary kids is the rhabdomyosarcoma. The most common benign hepatic tumor during the first 6 months of the life is the infantile hemangioendothelioma. The most common benign intraconal tumor of the orbit in the adult is the cavernous hemangioma. The most common benign mesenchymal tumor of the kidney is the AML. The most common benign mucosal tumor of the esophagus is the papilloma. The most common benign nasopharyngeal tumor is the juvenile angiofibroma. And the most common benign orbital tumor in the childhood is the dermoid cyst of the orbit. The most common benign ovarian neoplasm in the young and middle-aged women less than 45 years is the mature teratoma. And the most common benign radiation-induced tumor of the musculoskeletal system is the osteochondroma. And the most common benign revelation in an adult is the fibrous dysplasia. The most common benign soft tissue tumor of the foot is the plantar fibromatosis. And the most common benign soft tissue tumor of the vascular origin is the hemangioma. The most common benign solid tumor in the woman of the childbearing age is the fibroadenoma. Most common benign testicular mass. Here the testicular mass is the simple cyst. The most common benign tumor of the spleen hemangioma, and the most common benign tumor of the larynx is the squamous papilloma, and the most common benign tumor of the lung will be the hematoma. The most common benign tumor of the small bowel is the cyst. Most common benign vascular gastric tumor, glomus tumor of the stomach. The most common bilateral testicular tumor is the lymphoma, and most common cardiac tumor in the children is the rhabdomyosarcoma. All things I will be upload the video of all about the carcinoma in the later lecture after NEET PG exam, but I will not detail about that in this video due to your time is most important. Most common cardiac tumor in the children is the rhabdomyosarcoma, and most common site of the intracardiac papillary fibroelastoma aortic valve. The most common location of the hypertensive hemorrhage is the putamen or external capsule. This is very important. The most common site of the aneurysm in the chest is the descending thoracic aorta. Most common site of the cardiac myxoma is the left atrium. This also very important. This is also very important. Most common site of the intracardiac thrombus formation is the atrial appendages. This is also most important. The most common site of the optic melanoma is the metastasis liver. The most common site of the penetrating aortic ulcer is the descending thoracic aorta. This is also very important. The most common site of abdominal involvement in the Hodgkin's disease is the spleen. Most common site of aortic dissection. Most common site of the aortic dissection is the proximal descending thoracic aorta near ductus ligament attachment. The most common site of the monostotic fibrous dysplasia will be the ribs. The most common site of the rupture of the sinus valsalva aneurysm is the right ventricle followed by the right atrium. The most common colonic site for the lymphoma is the cecum, and most common extraadrenal site of the fibromyxoma is called as the organ of the Zikr candle. Your pronunciation will be different from my pronunciation, so make your own. The most common extragonadal site of the primary gel cell tumor is the anterior mediastinum. The most common extrapulmonary site of the tuberculosis urinary tract. The most common intracranial for the site of the teratomas is the pineal region, and the most common location for the cephalohematoma is the parietal. Most common location for the gastric diverticulum is the posterior wall of the gastric fundus. The most common location of for pilocytic astrocytoma is the cerebellum. You have to remember cerebellum, most important topic. Most common location for the solitary myeloma of the bone is the thoracolumbar spine. Just revise about the thoracolumbar fascia, which are most important. Most common location for the synovial sarcoma is the knee. Most common location for the Tarlov cyst is the posterior rootlets of the S2 and S3. Most common location for the abdominal sarcoid involvement is the stomach. Most common location for the atelectic asbestos tumor is the posterior medial lateral basal region of the lower lobe. The most common location for the chordomas is the sacral spine. The most common location for the gallbladder perforation is the fundus. The most common location for the sclerosing osteomyelitis of the gear is the sterile osteomyelitis is the mandible. Most important topic. The most common location for the tephlitis is the cecum, and most common location for well differentiated liposarcoma is the thigh, and the most common location in the biliary tract for cholangiocarcinoma is the upper third perihalar region. The next one is the most common location in the spine for an osteochondroma is the cervical, C2 followed by the thoracic T8. C2T8. The most common location of the meningioma in the spine is the thoracic spinal cord. Most important. Most common location for the periurethral diverticulum in the female is the posterolateral. Here the most common location of Ectopic pregnancy is the ampullary region of the fallopian tube. Most important. The most common location of benign and malignant mass in the breast is the upper outer quadrant. Most important. Most common location for the bronchogenic carcinoma, right upper lobe. Most common location of the coarctation is the postductal, beyond the origin of the left subclavian artery. This is also important. Coarctation. The most common location of the coronary calcification is the LAD, left anterior descending. Most common location of the DI is the frontotemporal gray-white matter junction. Most common location of the gist, it will be the stomach. The most common location of the GU obstruction in the neonatal male is the uretropelvic junction. The most common location of the intracranial dissection is the vertebral artery. You have make a note on the, that means make a image of the circle of Willis. One question always be on the circle of Willis. Most common location of the intraorbital abscess is the subperiosteal space on the medial wall. The most common location of the intraventricular meningioma is the atrium of the lateral ventricle. All ventricles are also important. That means ventricle, lateral ventricle, third ventricle and fourth ventricle, and the passage of the CSF. Important topic. Most common location of the pleomorphic genithoastrocytoma is the temporal lobe. This is also most important. And the most common location of the pulmonary sequestration is the posterior medial lower. The most common location of the oligodendroglioma will be the frontal lobe. This is also important. Most common location of the sarcoidosis in spinal cord, cervical, most important, and sarcoidosis is also important. The spinal cord, you have to remember the structure of a spinal cord, ascending and descending track, all things you have to remember so that you can't miss. The most common location of the biliary embryonal rhabdomyosarcoma is the CBD. The most common location of the triquetral fracture is the dorsal avulsion. Dorsal avulsion. The most common location to find a lithopedion is the adnexy. Adnexing or adnexy. The most common location to see intravertebral vacuum phenomenon or Kimmel disease is the thoracolumbar junction. The most common spinal location for the cord astrocytoma is the thoracic. Most important. Most common spinal location for the cord ependymoma is the cervical. Okay, astro start with T, so you have to remember T, thoracic, and in the ependymoma E is like a C, so cervical. Most common location to see asbestosis sequel is the posterior lower lobe. You can remember the which lobe are affected if the aspergillosis, asbestosis is the heavy weighted substance, so it will be settled down in the lower lobe, so that if you fall a stone piece in the filled water in the glass, then it will settle in the dome due to its weight. So you may remember it, the asbestos is the weighted substance, so it will be stay in the lower lobe of the lungs. So thanks, have a nice day. Thanks for watching my video. Thanks for the passion. Watch my video till last. Have a nice day again, and make a good performance of your spirit in the examination. So thanks again.